A 68-year-old man sat across from me recently, eyes lowered, voice barely above a whisper. He said, "Doctor, I used to feel better afterward, but now every time I finish, I just feel empty." He looked up at me with this mix of confusion and quiet shame, as if he'd been carrying this secret for years and didn't know who else to tell. And here's the thing, he's not alone, not even close. I hear versions of this same story every single week in my practice. Men in their 60s, 70s, even their 80s, who believed that what they were doing was harmless. After all, they'd been told it was natural. They'd been told it was even healthy. But what no one ever warned them, what the medical community rarely talks about openly, is that after a certain age, the rules change completely. What once felt normal can quietly, slowly start harming your body in ways you don't see coming until it's already too late. I'm Dr. Daniel, and welcome to Dr. Daniel Brooks. Advanced Health, the channel where we have the real conversations about men's health that yet most doctors don't take enough time for in a 15-minute appointment. I've spent decades working with aging men, helping them protect their vitality, their confidence, and their sense of self. And today we're going to talk about something that gets almost zero airtime, even though it affects millions of men silently, every single day. Now, before we go any further, I want to speak directly to you for a moment. If you're over 60, you probably already know that your body has changed in ways that surprised you. Maybe your energy isn't what it used to be. Maybe intimacy feels different, not just physically but emotionally. Maybe there are things you've noticed about yourself that you haven't shared with your doctor, your partner, or anyone. And maybe you've been quietly wondering whether the private habits you've carried since your younger years are still working for you, or whether they're working against you. If any of that sounds familiar, I want you to know that this video was made for you. What you're about to hear isn't about judgment, it's about awareness. It's about giving you the information you deserve so you can make choices that genuinely support your health at this stage of life. So stay with me, because what I'm going to share today might just change the way you see your own body, your habits, and your health. You've been told masturbation is safe, natural, and even good for you. And for much of your life, that was true enough. But here's what the research tells us, and what I see confirmed in my practice every single week. After 60, the hormonal landscape shifts dramatically. Testosterone production slows, blood flow decreases, recovery times lengthen. Neural pathways that once fired with ease now require more stimulation to produce the same response. The body you're living in at 65 or 72 is not the same body you had at 35. It has different needs, different thresholds, and different vulnerabilities. And when you continue the same habits without adapting them to your changing biology, something starts to go wrong beneath the surface. In this video, I'm going to walk you through the 5 biggest mistakes older men make. Mistakes that are silently affecting their mental health, their relationships, their sexual function, their hormonal balance, and even their prostate. And then I'm going to share exactly what I tell my own patients about how to navigate this part of life with wisdom, intention, and care. If this sounds like something you need to hear, go ahead and hit that subscribe button right now and turn on the bell so you never miss a video like this one. And if this topic is resonating with you even before we get started, type the number 1 in the comments below. It helps me know you're here, and it helps this message reach other men who need it. Let's begin with the first mistake. And it's one that most men never see coming, because it doesn't show up in a blood test or on a scan. It lives entirely inside the mind. The first mistake is using masturbation in a way that silently disrupts your mental health. I've seen this pattern play out in my practice more times than I can count. A man in his late 60s or early 70s walks into my office. He looks physically healthy. Maybe he's even active, goes for walks, watches what he eats. But mentally, something is off. He's more irritable than usual, more anxious, sometimes withdrawn from the people he loves most. He can't quite explain it. And when we sit down and really talk, when there's enough trust in the room for honesty, the truth begins to emerge. For years, sometimes decades, he's been using masturbation as a coping mechanism. Not for pleasure exactly, more as an escape from boredom, from loneliness, from the low-grade stress that comes with aging, with retirement, with change. What began as a harmless habit in his younger years has quietly transformed into something else entirely. Here's what's happening in the brain. After age 60, the neurochemical response to sexual release changes significantly. The surge of dopamine, that feel-good chemical that once delivered a powerful sense of calm and satisfaction, begins to diminish. Oxytocin, sometimes called the bonding hormone, which once created feelings of warmth and connection, also becomes less reliably triggered. What many men experience instead, particularly when masturbation is frequent or emotionally disconnected, is a wave of flatness afterward. Some men describe it as a fog that settles over them. Others say it feels like something important is missing, but they can't pinpoint what. What they don't realize is that repeated cycles of stimulation and release, without genuine emotional connection, are quietly rewiring their emotional baseline. The brain begins to associate sexual release with isolation rather than intimacy, with emptiness rather than fulfillment. Over time, if this pattern continues unchecked, the consequences can deepen. Research in men's mental health has shown strong associations between social isolation, low emotional connection, and increased rates of depression in older men. When masturbation becomes a substitute for genuine human engagement, it can accelerate that isolation. It can erode motivation, dull focus, and chip away at the emotional resilience that men need more, not less, as they age. And the most heartbreaking part? Most men never once suspect that this habit could be contributing to how they feel. They assume it's just getting older. They normalize the fog. They push through the flatness. And no one, not their doctor, not their partner, not their friends, ever brings it up. But it is avoidable. And once men understand this connection, once they can see it clearly, they begin to reclaim not just mental clarity, but emotional strength. Now here's the thing, while your mind may be suffering in silence, your body may be sending you an entirely different kind of signal, a physical one, and it's hiding in the slow, quiet disappearance of something most men don't even realize they're losing. Let's talk about the second mistake. The second mistake is allowing this habit to gradually replace real intimacy. I once asked a patient in his mid-70s a simple question. When was the last time you felt truly close to someone? He looked away for a long moment, then quietly said, I'm not sure I even remember what that feels like. He wasn't talking about conversation or companionship. He meant intimacy, the kind that involves another person, emotional presence, and genuine vulnerability. And over time, without fully realizing it, he had replaced that depth of connection with something far more convenient, far more controllable, and far more isolating. Masturbation, especially in older men, can become a silent substitute for real emotional and physical closeness. After 60, the circumstances of life often make connection harder to come by. Retirement can shrink social circles. Children move away, friends become less available, marriages evolve, and without the natural rhythm of daily connection, loneliness can creep in, quietly, without fanfare. Masturbation fills that gap easily. Too easily. It's available, it's private, it asks nothing of you. The problem from a neurological standpoint is that the brain doesn't always distinguish between genuine connection and its imitation. When a man regularly engages in solo sexual release without emotional closeness, the brain begins to adapt. It starts to treat self-stimulation as an adequate substitute for intimacy. And over time, the drive toward real connection, toward reaching for another person, toward the warmth and effort of mutual vulnerability, begins to fade. This isn't simply about sex, it's about losing the essential human current that makes you feel seen, desired, and alive. When a man loses that desire for genuine intimacy, something deeper tends to go with it. His sense of purpose within a relationship, his identity as a partner, his confidence in his own desirability. I've watched this happen slowly and silently in men who had no idea what was unfolding. The relationship doesn't collapse dramatically, it simply distances. Not because of conflict or resentment, but because of a gradually widening gap that no one names and no one addresses. And if this resonates with you, if you recognize yourself somewhere in this description, I want you to know that this is not permanent. Awareness is the first step toward a change. If you're still watching, type 1 in the comments right now. You're not alone in this, and every man who stays to hear this through gives himself a real chance at something better. But the physical consequences don't stop at emotional distance. They reach deeper into the body's very ability to feel pleasure, to respond, and to engage during real intimacy. This brings us to the third mistake. The third mistake is developing habits that quietly reduce the quality of your sexual experience. Not long ago, a gentleman in his late 60s told me something that stayed with me long after he left my office. He said, "Doctor, when I'm with my wife, it's like my body is there, but my senses aren't. It used to feel electric, now it just feels dull." He wasn't broken, he wasn't suffering from any identifiable disease, but something had shifted in how his nervous system responded to real intimacy. And it had everything to do with how he had been pleasuring himself when he was alone. When masturbation becomes mechanical, when it's rushed or overly dependent on intense and unrealistic stimulation, such as explicit video content, it begins to reshape the nervous system's expectations. This is especially significant after 60, when nerve sensitivity naturally declines and blood flow to sexual tissues decreases. The body is highly adaptive. It recalibrates constantly to the environment and stimuli you consistently expose it to. If your arousal patterns are being shaped by experiences that are fast, exaggerated, or emotionally empty, your nervous system starts treating that as the standard. It begins requiring that level of intensity to respond. And real intimacy, slower, warmer, more emotionally layered, starts to feel comparatively flat, understimulating, unrewarding. The clinical term for this is desensitization, and the research behind it is compelling. Studies on dopamine pathways show that repeated exposure to high stimulation content can raise the threshold required for arousal, making more natural relational intimacy feel insufficient by comparison. For men over 60, whose neurochemical systems are already recalibrating due to hormonal shifts, this effect is amplified. The result is a man who is physically present with his partner, but emotionally and sensorially absent, who wants to be there but can't quite connect, who begins to question his own masculinity and silently wonders whether something is fundamentally wrong with him. Most of these men blame aging. Aging is not the primary cause. The culprit is a pattern of self-stimulation that has trained the body away from natural human connection. The good news, and there is genuinely good news here, is that this is reversible. The nervous system, even in older age, retains a remarkable capacity to adapt. When the patterns change, so does the response. But first, you have to understand what's happening. And understanding is exactly what you now have. What comes next goes even deeper into your biology, into the hormones and physical systems that power your sexual health. This is where the fourth mistake lives. The fourth mistake is not recognizing how excessive frequency can reduce sexual and reproductive capacity. A retired man in his early 70s came to see me about a year ago, someone who had been physically active his whole life, no major health issues, no serious medications. But something had shifted. His energy had dropped noticeably. His erections were weaker than they'd been even 2 years prior. And his sense of himself as a sexually capable man was slipping in a way that frightened him. He said quietly, "Doc, I still feel desire, I just don't feel capable anymore." When we worked through his history carefully, the piece that stood out most wasn't a diagnosis, it was a habit, frequent masturbation, carried from his younger years into his older ones, without any adjustment for the physiological realities of aging. Here's what happens inside the body that most men are never told. As we age, testosterone production slows, measurably and progressively, after around age 30, with a more significant decline after 60. Blood flow to sexual tissues decreases. Recovery after ejaculation takes longer, sometimes significantly longer, and every ejaculation draws from the body's finite hormonal and energetic reserves. In younger men, those reserves replenish quickly. The body bounces back, but in older men, that recovery window expands. The tank refills more slowly. When masturbation is infrequent and intentional, this isn't a problem. The body manages it without difficulty. But when it becomes frequent, driven by boredom, habit, stress, or emotional avoidance, rather than genuine desire, it begins to drain the very resources that power a man's sexual vitality. The clinical consequences can include reduced ejaculatory volume, weaker erectile response, longer recovery periods, and increased susceptibility to prostate irritation. The prostate, already under age-related pressure from natural enlargement, can become inflamed and sensitized with repeated, frequent stimulation. Over time, what was once a robust and dependable sexual system begins to feel unpredictable, fragile, unreliable, and men almost universally blame aging for this. They accept it as the inevitable price of getting older. But it isn't inevitable, it's a pattern, and patterns can change. This sets the stage for the fifth and final mistake, one that lives in the body's most sensitive and often most ignored system. One that, left unaddressed, can steal your sleep, your comfort, and your confidence. The fifth mistake is ignoring the impact on urinary health and the prostate. I treated a 71-year-old man who came to me with a concern that seemed straightforward at first: frequent nighttime urination and a persistent, dull pressure in his lower abdomen. He'd assumed it was simply age catching up with him. He'd mentioned it almost apologetically, as if it were too minor to bring up. But when I examined him thoroughly, the picture that emerged was more complex. His prostate was inflamed, his pelvic floor was under significant strain, his bladder wasn't emptying efficiently. And when I gently asked about his daily habits, all of them, he hesitated, then admitted that he had been masturbating almost daily for years, never once connecting that habit to the symptoms he was experiencing. After 60, the body becomes more sensitive, more reactive, and significantly less forgiving of strain and excess. The act of masturbation, particularly when it involves tension, forceful technique, or is done without mindful awareness of the body's cues, places real stress on the delicate, muscular, and vascular structures of the pelvic region. The prostate, already managing the pressure of natural age-related enlargement, can become irritated and inflamed. This can manifest as discomfort during or after ejaculation, urinary urgency, difficulty initiating urination, a burning sensation, or that frustrating feeling of never fully emptying the bladder. Repetitive stimulation can also sensitize the urethra, contributing to what urologists call lower urinary tract symptoms, a cluster of issues that disrupt daily life in surprisingly significant ways. The warning signs often start subtly: the extra trip to the bathroom at 3 a.m, the dribble that lingers after you think you're done, the dull ache in the lower abdomen that wasn't there last year. These things are easy to dismiss, easy to normalize. But they're the body's early language, a quiet request for adjustment, that, if ignored, becomes a louder and harder to ignore demand. The concerning pattern I've observed in practice is that these symptoms tend to compound. Sleep disruption leads to fatigue. Fatigue affects mood and confidence. Confidence issues affect relationships, and the whole cycle tightens. What began as minor urinary symptoms becomes a much broader erosion of quality of life, and at the centre of it, a habit that could have been adjusted before any of this accelerated. But here's the message I want every man watching this to hold on to. These issues are not irreversible, not by a long stretch. With the right adjustments, thoughtful, manageable, sustainable changes, most men can protect their prostate, restore comfort, and feel genuinely well again. And that brings us to the most important part of this conversation. This section is what I tell my own patients, the practical, honest advice that I give in my exam room every single week. And I want you to have it too, because you deserve more than a diagnosis. You deserve a path forward. The first and most important thing I want you to understand is this: none of what we've discussed today is about shame. Shame has no place in healthcare, and it has no place in this conversation. What this is about is awareness, and awareness is the most powerful medicine I can offer you. After 60, your body asks for something different. It asks for more patience, more gentleness, more intention. If you still choose to engage in masturbation, and many men do, and there is nothing wrong with that, the key is to approach it as a genuine form of self-care rather than an escape or a compulsion. That distinction matters enormously. In terms of frequency, I generally recommend no more than 2 to 3 times per week. For men in this age range, and for many even less, is appropriate. This gives the body the time it genuinely needs to recover, hormonally, neurologically, and at the level of the tissues themselves. Think of it as working with your biology rather than against it. Give your system room to replenish before drawing from it again. Cleanliness matters more than many men realize. After 60, the immune response is less vigorous than it once was, and minor infections that a younger body might resolve easily can become more persistent and more problematic. Simple hygiene before and after is a straightforward, non-negotiable protection. Be gentle. This cannot be overstated. The skin and tissues of the genitals are thinner and less resilient than they were at 40. Techniques that felt comfortable in earlier decades may now cause irritation, microabrasion, or even injury. Lubrication is often helpful and appropriate, and the approach should be slow and considered, not forceful or rushed. Choose your timing thoughtfully. I advise against using masturbation as a response to stress, frustration, anger, or emotional pain. The mind-body connection is powerful and real. When sexual release is repeatedly paired with states of emotional distress, it reinforces neural pathways that can worsen mood dysregulation over time. Instead, engage from a place of genuine ease when you are calm, rested, and emotionally settled. Reduce or eliminate reliance on explicit visual content. I've watched too many patients, particularly older men, develop emotional numbness and unrealistic arousal templates from extended exposure to explicit material. The effect on how you experience real intimacy and real life can be significant. The brain adapts to what you consistently feed it. Feed it well, and finally, listen to your body. Not just during these moments, but in the hours and days following them. If you notice increased fatigue, pelvic discomfort, urinary changes, or emotional flatness after masturbating, your body is communicating with you. Don't suppress that signal. Honor it. And please see your doctor. These symptoms are worth discussing openly. There is no reason for embarrassment. Your doctor has heard it all, and the right care at the right time makes an enormous difference. You are not broken. You are aging and aging done right is not a slow defeat. It is a deepening. It is a refinement. It is the earned wisdom to treat your body with the intelligence and care it now requires from you. Before we close, I want to take a moment to ask you something directly. Are there men in your life who need to hear this? A brother, a friend, a father? This is the kind of information that most men never receive. Not from their doctors, not from their partners, certainly not from popular culture. If this video has given you even one insight that shifted your thinking, please share it. You could be giving another man something genuinely important. Drop this video in a message, send it to a group chat, share it on social media. Every share matters more than you know. And if you haven't already, this is the moment to subscribe to this channel and hit the bell notification. Every week I bring you real health conversations, evidence-based, honest, and designed specifically for men who are serious about how they age. Let me leave you with this. In our time together today, we've uncovered 5 silent mistakes that are quietly affecting the health and well-being of older men around the world. We've seen how frequent, emotionally disconnected masturbation can cloud mental clarity and deepen loneliness. How it can replace the warmth of real intimacy with a convenience that leaves you more isolated, not less. How it reshapes the nervous system's response to pleasure, dulling the experience of true connection. How it depletes the hormonal and physical reserves that power a man's sexual vitality. And how it places real and measurable strain on the prostate and urinary system in ways that deserve serious attention. None of these mistakes make you weak. None of them make you broken or beyond help. They make you human. A man navigating a stage of life that no one adequately prepares you for. But now you have something most men don't: clarity, understanding, and a clear, practical path forward. I've spent my career listening to men who struggled in silence, men who thought their questions were too embarrassing to voice, men who assumed their confusion was theirs alone. I am here to tell you that you are not alone, that your health matters deeply, and that the choices you make from this day forward have real power. Your vitality is worth protecting. Your relationships are worth investing in. And yes, your pleasure is still valid. It just deserves to be expressed in ways that honor the body and the life you have right now. So take what you've learned today and make one small intentional shift. Maybe that's spacing things out. Maybe it's approaching this part of your life with more mindfulness and less automation. Maybe it's having a long overdue conversation with your doctor or your partner. Whatever your next step is, take it with intention, with self-respect, and with the quiet strength of a man who knows that real wisdom isn't about avoiding difficult truths. It's about facing them and growing from them. Aging doesn't mean fading, it means refining. And when you know how to work with your body, not against it, not in ignorance of it, you will be genuinely amazed at what is still possible for you. This isn't an ending, it's a beginning. A new chapter, one that leads with health, connection, and confidence. I'm proud of you for watching this all the way through. That took courage, and I'm right here with you for every step forward. If this message spoke to you today, drop a 1 in the comments below. I read every single one. Hit the like button to help this reach more men who need it. Share it with someone you care about, and subscribe to Dr. Daniel Brooks. Advanced health, because this is just the beginning of the conversation your health deserves. I'll see you in the next video. Take good care of yourself, because you are absolutely worth it.